With more preparing to return to the classroom as soon as next week. The federal government encouraging in-person learning, but that leaves many questions about the risk COVID-19 could pose to kids. News 2's Alex Dennis spoke to several local doctors about this recent jump in pediatric cases in Tennessee.
It's a new COVID-19 trend published by the American Academy of Pediatrics.
Tennessee actually leads the U.S. right now in the percentage of our COVID cases that are under the age of 18.
According to the report published July 23rd, Tennessee was one of 9 states where pediatric cases of COVID-19 exceed 10,000. Tennessee now has 13,264 ped cases, which makes up 15.7% of total active cases in our state.
In Tennessee's data for pediatric patients, that includes patients that are up to the age of 20.
Local doctors believe a majority of active pediatric cases are adolescents and preteens.
There's nothing to suggest that a Tennessee child is more at risk than any other child in the U.S. It's not a susceptibility difference. It's probably an exposure and an activity thing, sports, camps, things like that.
As more people move about the state, a steady rise in cases puts 97% of Tennessee counties near critical outbreak status. The AAD report also indicates 76 pediatric patients have died throughout the country from COVID-19. 3 of those are in Tennessee, a majority having underlying health conditions.
And as the total cases go up, even something with a very low mortality rate will occasionally cause death,
leaving doctors unable to say with certainty what will happen when students return to campus.
There's a lot we don't understand, so I don't think anybody can say anything with a high degree of confidence about what's going to happen because it's all still too new.
Alex Dennis, News 2.
All right, day by day, doctors say if your child has shortness of breath, call your pediatrician immediately.
Our coverage of the COVID-19 pandemic takes us now to DeKalb County, an area that made the list of COVID-19 emerging hotspots being watched by the federal government. News 2's Nicole Smith explains why some residents are not surprised.
The streets of historic downtown Smithville were quiet Thursday morning as the worldwide COVID-19 pandemic tightens its grip on more small towns across the United States.
I'm heartbroken because I'm a traveler and I loved my life. I got to go a lot of places, I got to do a lot of things, and now I'm terrified to get on a plane.
DeKalb County was included on a daily hotspot triage report distributed by the Department of Homeland Security and obtained by ABC News. It identified 98 emerging hotspots in 30 states, and 21 of those were considered new emerging hotspots.
From the get-go, I don't feel like we as DeKalb Countyans took it seriously. About 2 weeks ago, I guess I was in a local store and I had my mask on. And I think myself and my husband were the only 2 people in the entire store that had our masks on, besides the employees.
According to the Tennessee Department of Health, DeKalb County clocked 269 cases of COVID-19 Wednesday afternoon, up from 119 cases 2 weeks before. That's a 126% increase in the past 2 weeks.
It is surprising, but then it's not, because we're such a small town, and, you know, myself, I go out of town to do any kind of shopping.
This county and others in the region have been a focus for the White House Coronavirus Task Force this week. Hardin and Haywood counties in the southwestern part of the state and Jefferson County just east of Knoxville also made the DHS list of emerging hotspots. Reporting in DeKalb County, Nicole Smith, News 2.
The county of roughly 20,000 people currently has 159 active cases. 1 person has died.
All right, coronavirus is on the decline in Nashville. Wonderful stat there. The mayor says, of course, we're not out of the woods yet, but numbers are improving. This is a look at the 7-day moving average of new cases in Davidson County. The numbers are about the same as they were about a month ago, but now they're falling instead of rising. It's huge. We're all getting used to wearing masks in public, but the mayor's task force, they also say we need to help officials and also work to be our own contact tracers.
You know who you've been in contact with for closer to 6 feet for more than 10 minutes, okay? You can call those people. Now, don't make it a visit in person to tell them, but call them. Say, hey, I've tested positive. I think you should self-isolate and go get tested if you're symptomatic. Every individual has an obligation to take care of their neighbor in this crisis.
And we can do this together, everybody. Of course, this doesn't mean the city will stop its contact tracing. For now, Nashville is still, remember, in a modified phase 2 of its reopening plan.
Another breaking news alert to tell you about now. Metro Police say one man is likely responsible for at least 2 robberies in Nashville.